Hello dear, how are you? Today I will talk about vaginal infection. Overview. Vaginitis. What is vaginitis? Vaginitis describes a few conditions that can cause infection or inflammation of your vagina. Vulvovaginitis describes inflammation of both your vagina and your vulva. Your vulva is the external part of your genitals. Symptoms of vaginal infection. Some vaginal infections may not produce any symptoms. The most common symptoms are vaginal itching, a change in the amount of discharge from your vagina, a change in the color of your vaginal discharge, pain or burning during urination, pain during intercourse, vaginal bleeding or spotting. The symptoms of vaginal infections will also vary based on the cause of your infection. Bacterial infection typically cause grayish-white or yellow discharge. This discharge may have a fish-like odor that's easily noticed after sex. Yeast infection typically produce itching. If discharge is present, it may be thick and white and look like cottage cheese. Trichomoniasis is a condition that can produce vaginal itching and odor. Discharge from this infection is typically greenish yellow and may be frothy. Causes of vaginal infections. Common causes of vaginal infections include bacterial infections, yeast infections, usually caused by a fungus called Candida albicans. Trichomoniasis, caused by a protozoan parasite that can be contracted through sexual intercourse. Vaginal atrophy, this condition commonly occurs after menopause. Irritants, caused by soap, body washes, perfumes, and vaginal contraceptives, can all irritate your vagina. This can cause inflammation. Tight-fitting clothes may also cause heat rashes that irritate your vagina. Causes of vaginal infections. In some cases, your doctor may not be able to determine the cause of your vaginal infections. This condition is known as non-specific vulvovaginitis. It can occur in women of any age, but it is more common in young girls. How are vaginal infections diagnosed? To diagnose a vaginal infections, your doctor will ask you about your health history, about your sexual health, such as your current number of sexual partners, your history of past vaginal infections or sexual transmitted infections. Your doctor may also perform a pelvic exam. During this pelvic exam, your doctor may collect a sample of vaginal discharge. They will send this sample to a laboratory for analysis. Treatment of vaginal infections. Treatment for vaginal infections will depend on what's causing your infection. For example, metronidazole tablets, cream or gel, or clindamycin cream or gel may be prescribed for bacterial infections. Antifungal creams or suppositories may be prescribed for yeast infections. Metronidazole or tinidazole tablets may be prescribed for trichomoniasis. Estrogen creams or tablets may be prescribed for vaginal atrophy. If your infection is caused by an irritant such as soap, your doctor will recommend a different product to reduce irritation. How can you prevent vaginal infections? Not all vaginal infections can be prevented using a condom during sexual intercourse will help prevent the spread of STIs, sexual transmitted infections. Proper hygiene can also help prevent some vaginal infections. When possible, you should wear cotton underwear. Thank you for watching. If you feel this information is useful for you, please like, share, and subscribe.